and talk about how proton therapy can treat them. So if you have maybe at the base of the skull, you have a tumor, how effective is proton therapy for that?
So proton therapy is excellent in this location. For the tumors that are at the base of the skull and in the brain, we are close to a number of critical structures.
Okay.
The developing brain is very important, particularly in children. It is important to spare normal brain tissue so that we have preservation of memory,
okay,
thinking, processing speeds, school performance, job performance. All of these things are absolutely critical. And we also are in close location to the eyes, the nerves that control the vision, the hearing centers within the brain, the hormone centers within the brain. So all of these things can be spared preferentially by proton therapy, and that's why it's so commonly used for adults and children with brain tumors.
Right, so I was about to add, you are a pediatric, that's your expertise, so we are talking about kids right now, but people need to know this is also great for adults.
Yes, so the primary indication for proton therapy is any curable tumor where we can provide significant sparing of normal structures. So on our list of other disease sites, breast cancer is actually a very common type of tumor that we treat with proton therapy, particularly left-sided breast cancers when we need to treat the regional lymph nodes that are in close proximity to the heart. The proton therapy can treat the breast and those lymph nodes, and it can stop before it causes unnecessary radiation exposure to the heart. And this is incredibly critical for our future women with breast cancer survivors, because we expect that they will continue to go on, and we want to prevent them from having complications, heart disease down the road.
How long has proton therapy been around?
Proton therapy was first created and used for treatment in the 1950s.
Oh.
So it's actually not so new. But over time, we have moved away from particle physics laboratories that were experimental, and we have moved into the medical realm. In this capacity, more and more patients each year are treated with proton therapy. According to recent numbers from the Proton Collaborative group, approximately 40% of children in the United States who are treated with curative intent with radiation received proton therapy.